subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors Today. We are delighted to have here with us Dr. Prasad Pande. For some reason, Dr. Baman Dhabar, who was supposed to be here, couldn't make it, and it's been our pleasure to have Dr. Pande here. Dr. Pande is also from Fortis Hospital. He is a laparoscopic, a gastro, and a liver and pancreas surgeon. He's worked with the Pant Hospital in New Delhi and the Lilavati Hospital in Mumbai. He was trained with stalwarts of gastrointestinal surgery in India. He has more than a decade of experience in the practice of gastrosurgery. He's an experienced doctor in pancreatic and upper gastrointestinal surgery, including esophageal, gastric, and gallbladder cancer. He has written more than 20 research articles that are published in international peer-reviewed journals and has delivered talks in international conferences. Dr. Dhabar is here, was going to be here and talking about, because it is World Cancer Day today, to talk about treatment, to talk about care for cancer. And we have requested Dr. Pande to be speaking on the same subject. So over to you, Dr. Pande. How have you been?
Yeah, good evening, Mr. Maheshwari. Thank you for inviting me on this wonderful platform. And it's always a pleasure to talk about healthcare. And it's a very important topic in our current times, where we are seeing diseases of all kinds, across all ages. We've recently had a very bad pandemic. The world has suffered for 3 odd years. But to have a disease that has suddenly cropped up and has probably as suddenly gone away is very different than to have a disease like cancer that is slowly growing and only growing. So yeah, it's
Doctor,
what we are going to talk about.
Sorry, I was just saying that I'm going to request you to make your opening remarks, and then we'll get on to questions from the audience. Those of you who have questions can put it in the Q&A tab. As always, I will look at them, and if there's no repetition, we will ask Dr. Pande here to address them. Please mention your age and your gender so that Dr. Pande could give a considered reply. Over to you, Doctor.
Yeah. So today is World Cancer Day. And what we are going to talk about today is cancer. So naturally, it's a matter of concern that cancer is increasing day by day. Not only the number of patients being diagnosed with cancer are increasing, it is also that we are diagnosing more and more different types of cancer on a daily basis. As a disease, cancer is not a single entity. There are so many organs in the body, and each organ has its own set of different types of cancer. But probably the one thing that is common to all cancers is that yes, it is a menace to the health of the patient, and it is a huge burden mentally, physically, and financially for the patient. So, as they say, prevention is better than cure, and a stitch in time saves 9. So both these sayings are highly applicable to cancer, in the sense that if you can prevent cancer by probably changing your diet, changing your lifestyle, then of course there's nothing like it. But if at all you are unfortunate enough that you have some disease, you have some cancer that is developing, it is better to diagnose it in time so that you can receive the best possible treatment and not let it get out of hand, as they say. I am basically a gastrointestinal and liver and pancreas surgeon. I see a lot of food pipe cancers, liver cancers, pancreatic cancers, colonic cancers. And the amount of exposure that we have on a daily basis to all the environmental pollution, to all the food adulteration, plus the amount of genetic mutations that we have been seeing, the number of cancers has increased. And now we are at a stage where fortunately healthcare has advanced so much that we can now diagnose cancer at a very early stage, and we can treat it to such an extent that the patient has a near normal life expectancy. So cancer is no longer a death sentence, provided you catch it early. And that is the theme of this year's World Cancer Day. The theme is to unite our voices and to take action. So what it means is that doctors, paramedical staff, and the patient, all of us, we have to come together and we have to take action. And the action is that we have to diagnose cancer early. So with that, I think I'll ask you people to ask me any questions that you may have. And with senior citizens, especially who suffer from various diseases that not only makes them more prone to have cancer, it also makes the treatment of cancer more difficult. So again, like I said, a stitch in time saves nine. You diagnose it early, and you'll be able to treat it better.
Uh, Thank you, Doctor, for your opening remarks. I just have a couple of questions to ask you before I look at the questions that are coming from people. Is from your experience, has the number of cancer patients increased? Are more people being diagnosed of cancer than they were earlier, or is it static, or has it gone down? What is the
So, just to give you an example, every year, 45 lakh people in the world are diagnosed with colon cancer. And colon cancer is not even the commonest cancer in the world. So, yes, the number of patients who are being diagnosed with cancer is increasing every year. But there are two aspects to it. One is that the number of patients suffering from cancer are increasing. And the second part, which is probably a little bit more encouraging, is that our healthcare system, our screening protocols, our investigations, our diagnostic techniques are also improving so that we are now able to diagnose more and more patients with cancer, and we are able to treat them. So it is probably 50 years ago when all these genetic tests were not there, when all these imaging techniques like CT scan and MRI were not there. We used to have a lot of patients who, died of unknown cause. And there's a term that is used in Europe and British literature, that the patient died of consumption. So consumption is essentially something that eats away at your body. And yes, cancer was one of the major causes of consumption. So now we are able to diagnose it. Now we are able to put our finger on it that this is the organ, this is the diagnosis. And these are the parts where the cancer may have spread or may not have spread. So the diagnosis has increased, but that is also because our ability to diagnose has improved. But yes, what you said was correct, that the number of cancer cases has increased, and there are a lot of factors to it. Environmental factors, water pollution, air pollution, all sorts of it. There are multiple genetic mutations that have also now come into play that were probably not present maybe 100 years ago. Uh, there are a lot of environmental, and when I say environmental, I also include the lifestyle factors like smoking and alcohol consumption and processed food. So all that has definitely increased the number of people suffering from cancer every year.
right? Doctor, you mentioned about 45 lakh people getting the colon cancer. Now, is there, so what is the pie like in terms of, where are the maximum number of people, what kind of cancer are they suffering from?
So, most common cancers are those of the oral cavity and the breast and lungs. So, there are differences in male population and female population. Of course, female population will have breast cancer on a much higher incidence. Male patients will have lung cancers and prostate cancers much more frequently. But like I said, colon cancer in both males and females is the third most common cancer. Breast cancer is most common in females, followed by lung. In males, it is the oral cancer which is most common, followed by lung, followed by colon. So the the most important part is that the number of these cases the number of these cases is increasing across the world. There's no particular area which is more susceptible to all types of cancer. Yes, there are some geographical distributions, like gallbladder cancer is more common in Uttar Pradesh and Bihar in India as compared to Bombay. Gastric cancer, stomach cancer is more common in southern states. But like I said, there is no particular area that has all types of cancer being more common than the others. So there are various types of cancer, there are various causes of cancer, and that is what has driven the numbers of cancer patients everywhere.
Doctor, I have asked this question to other doctors in the past, but what is your assessment of medical facilities for cancer? For instance, in the, say 20, 25 years back, there was Tata Memorial Hospital in Mumbai, which is where, everybody would go.
True.
And there were people outside the hospital. There were queues outside the hospital. There were people on the footpaths there. And but of course, now in a city like Mumbai itself, you have your hospital, which is there in the suburbs, and there are various other hospitals which have top doctors. So what is what are the facilities like, and especially for people from outside Mumbai? Is there can one be sure that you are getting best quality treatment elsewhere in the country as well?
Yeah. So one aspect of healthcare is the availability of medical personnel and medical infrastructure. And while both have increased over the last 3 decades or something, but still we have just taken one step in a long, long staircase. When you say that 25 years ago there were lines outside TMH, it pains me to say that the lines are still there. That as we have not been able to catch up with the number of increase in cancer patients. Yes, we have the facilities are there. There are hospitals like Fortis which cater to all classes of citizens, irrespective of their their age, their gender, their financial status. But still, there are uh, there are patients who are not able to reach a place where they can get treatment. And rural India, unfortunately, still has a lot of gap in the care for cancer. There is lack of awareness, yes, but there is lack of care also. There's lack of availability of care also. So to summarize, what I would say is that the journey of a patient from his home to his family doctor to a specialist to a specialized medical center, this journey unfortunately is shorter than what it was 20 years ago, but still it is not as short as we would like it to be. We are still lacking in the amount of care that we can offer to these patients.
Doctor, since you're talking about this in terms of the availability and the fact that there are still queues at a hospital like Tata Memorial, do you see that there are people who are advancing to, stage a higher stage of cancer just because they do not have the necessary treatment level in their region, or they're perhaps discovering late?
Unfortunately, yes. Uh, Especially in a city, in a third world country like India, and a city that is literally exploding with people like Mumbai, uh, it is very difficult to, get every patient treated on time. But at the same time, the side effect of that, the unfortunate side effect of that is that by the time the patient comes to you, maybe 5 out of 10 patients have already advanced to a stage where you cannot offer them a curative treatment, where what you can do is, control the tumor, you can extend the lifespan, but you cannot take the cancer completely out. So 50% is where I would place that judgment, and it's still a long way to go.
All right, I appreciate. I think still it's a long way to go, but I'm glad that there are facilities available now increasingly in within Mumbai city as well as elsewhere in the country. Uh, and but okay, one last question on the healthcare facility itself. So are there hospitals you've practiced as in Delhi as well? At least the big cities, would you say that they have care available as good as what you would have at Tata Memorial?
Definitely. Place where I work, GB Pant Hospital, is one of the main centers for gastrointestinal and liver and pancreas cancers in northern India. But apart from that, also there are multiple government as well as private centers that offer a good quality healthcare, good quality cancer treatment to patients. And of course, there will be certain differences, but then the aim of treating a cancer patient effectively is being fulfilled at a much better rate, at a much faster rate across the country. TMH, yes, it is a beacon of hope for everybody, for all cancer patients. But what must be stressed is that if you overburden a place with too many patients, when same or similar facilities are available at, see, we are all in a phase of decentralization of services. So what is available in Mumbai can also be available in a place like Indore or a place like Jaipur, which are not which are upcoming metros. So a patient coming in from these upcoming metros to places like Mumbai or Delhi is no longer a necessity to get effective cancer treatment. They can get equally good cancer care in their own cities. And these centers are now coming up more and more frequently as more and more cancer specialists, be they surgeons or be they oncologists, they are getting trained at Apex institutes. So this training of doctors is of paramount importance in decentralizing the cancer services in India.
Right, absolutely, doctor. Before I go further, I must alert people here that today we have also a special article by Dr. Suresh Advani, who's also attached to the Fortis Hospital, who has written
Yeah,
on cancer in older adults, understanding the systems and treatment. And what I'm going to do is I'm putting the link over here in the chat box. So those of you who would like to read it can also do that. That is Dr. Suresh Advani, who is one of India's foremost doctors on cancer. He was here, if you remember,
absolutely.
um, uh, at the Health Live webinar last year around World Cancer Day, which is on February 4th. Doctor, we have a few questions that have come in. This is from
Sure.
Mr. Bharat Mehta, who's 6. He says, what precaution senior citizen must take to stop prostate cancer problem in old age? Which medicine one must have to stop the prostate problem?
Okay. So prostate cancer, around 9 out of 10 times will arise from an enlarged prostate. It is very unusual to have a normal sized prostate having a prostate cancer. So the symptoms of an enlarged prostate will be difficulty in passing urine, having to go for passing urine 3 to 4 times in the night, having a little burning sensation in the urine. So what applies to all cancers also applies to prostate cancer, that if you have any difficulty, if you have any symptoms, please don't ignore it. Get yourself tested, go to a specialist, get investigations done so that it is very difficult to miss out on a disease like a treatable disease like prostate cancer if you investigate it early enough. The Now prostate cancer is very well treatable by endoscopic surgery. Now we have robotic surgery coming up. So the treatment has evolved, and the trick is to diagnose it at a stage where you can cut out the prostate. And unfortunately, there is no medicine that you can take to prevent prostate cancer. But the key is early diagnosis, like all cancers. If you have any urinary symptoms, go to your doctor, go to a urologist, and get yourself tested. At the most, what will happen is that you will have a negative test, which is good news for everybody. But ignoring the symptoms is what will land you up in a advanced disease where the doctors may not be able to help you.
And a PSA test is a must for everyone above the age of 50.
Yes, absolutely. So there are screening protocols in Western countries, which unfortunately in India are not as developed. But yes, a yearly PSA test is desirable for all males above 50 years of age. And if you have a slightly raised value, it can be because of urinary infections, it can be because of other reasons as well. But if you have a value that is ranging in double digits or above 100 or so, then definitely you must see a urologist and get all the necessary tests.
Right. Uh, Doctor, there's a question about liver cancer. And the question is that, is it not possible to know about liver cancer when it is at an early stage? I have heard of a lot of people who have had liver cancer and it's all at an advanced level.
Yeah, so unfortunately, liver cancer only around 35 to 40% of patients present at an early stage. Rest more than half of the population presents with an advanced liver cancer. But there are, like, again, like with prostate cancer, with liver cancer too, the symptoms will be a little vague. The patient will have vague abdominal discomfort. There may be a little fullness on the right side of abdomen. There may be a little bit of indigestion. The patient feels that the food is not getting digested well. There may be some amount of weight loss. So all of these are warning signs that the body is giving you that not all is normal with the liver. Now, liver cancer is very common in patients who have cirrhosis, what we call chronic liver disease. So patients who have cirrhosis are advised to undergo a sonography every 3 to 6 months, so that if there is a small tumor developing in the cirrhotic liver, we catch it early and we treat it. So for those of you who are not cirrhotic, again, good news that you don't have cirrhosis, so your chances of liver cancer are very low. But if you have chronic liver disease, if you have cirrhosis, then yes, you must get yourself a sonography every 3 to 6 months.
Right. Doctor, there's a question that has come in
Mhm.
from Mr. Dinesh Paliwal about what kind of blood tests can be done for cancer screening.
Okay, that's a very good question. And see, there are various types of blood tests. There's unfortunately no one universal test that detects all types of cancer. But yes, there are organ specific and cancer specific blood tests that can act as screening tests. So there is a test called alpha fetoprotein for liver cancer. There's a test called carcinoembryonic antigen for colorectal cancer. So these tests will give you an idea, like PSA for prostate cancer. So if you have a slightly elevated PSA, it does not necessarily mean that you have prostate cancer, but it does mean that you need to investigate further. So what what should be underlined and what must be understood is that these are screening tests. They may not be 100% accurate. You may have slightly abnormal values in absence of cancer. You may have absolutely normal values in presence of cancer. But you should do a screening test when there is a related symptom. There is no rhyme or reason, and there is no sense in doing blanket blood tests, what we call tumor markers. There's nobody does blanket tumor markers as a part of a routine health checkup. But if you have a specific symptom, it is better to get a screening blood test so that you know if any further investigation is needed or not.
That's right. And these indicators are thrown up in your annual medical tests, comprehensive tests.
So most centers, at least till now, don't offer these tumor markers as part of the routine health checkups.
So
But
the need for having it, other than the symptoms, is there? These obviously don't get thrown up in the comprehensive tests that one must have.
yeah, yeah. So like I said, that these screening blood tests are not part of a routine health checkup. But then we have certain other tests that are, that can detect these tumors at an early stage. Most health checkups will have a chest X-ray. They will have a abdominal sonography. For females, there are packages that include mammography. So these are all tests that are part of a health checkup that is essentially in a patient who does not have any symptoms. And if you don't have symptoms, but your health checkup has shown a small tumor in these tests, then yes, you are lucky that you have an early diagnosis of a lesion that may be cancerous, it may not be cancerous.
Right. Absolutely. I think the key thing is to, because the thing what happens is you mentioned about indigestion, etc. Now, at
Yeah.
at a senior age, indigestions are almost part of par for course. You have something heavy, and you feel a sense of indigestion for a few days. It may not last,
Correct.
which may last beyond 4 or 5 days. So, at what stage do you think that indigestion that you may have, or a stomach pain, or heartburn, or whatever, could be something more?
Okay. So again, thanks. That's a very good question. It is very easy for us doctors to, blame the patients when they come in at an advanced stage. कि अरे तुम पहले क्यों नहीं आए? But doctors must also introspect that a lot of times patients do come in with vague symptoms, and they are prescribed medicines and sent away. So it is not the patient's fault. It is not the doctor's fault. It is just that the uh, the symptoms are such that you cannot get a sort of a whole body scan for every patient who comes to you with indigestion. So what you asked was very relevant, that at what point do you investigate more? And I think the point is that if you have anything out of the ordinary, like, see, if my mother is 70 plus, she's a diabetic, she's a hypertensive, and anytime she eats anything out of the ordinary, she has a bit of heartburn and she pops in a pill and it is okay. There
Right.
are millions of such patients. If out of the ordinary schedule, even if you are eating your normal meal and you are still getting indigestion, even if you are taking some medicine for the indigestion, but the the symptoms are not improving. That is the point where you must know that it is not routine, it is not normal. So anything out of the routine schedule, routine recovery of body must be investigated.
Yeah, because I think this is, this is an issue which a lot of people do face, and especially things like indigestion and stomach ache and all of that. Uh,
So
so
a rule of thumb that I follow is that if any patient has acidity, we describe everything as acidity, but if any patient has acidity and heartburn for more than 2 weeks with treatment, then that patient must undergo an endoscopy. If any patient has constipation that has lasted longer than 2 weeks despite taking medicines, then that patient must undergo a colonoscopy. So the trick is to not stretch things too far so that you miss the bus.
right, absolutely. And one of the problems, one of the facts of life these days is that people search on the internet. So you have Dr. Google, which is at play. So sometimes
Yeah,
it can actually scare you that
true.
an indigestion could well be cancer, and you either get scared or you dismiss it. And
True.
so that's also a thing. Is that something that you find these days, that people are.
Absolutely. People search their symptoms on Google or WebMD, and the searching part is not the problem. The problem is drawing their own interpretation out of it.
Right.
So it is good to use the internet to gain knowledge, but you must know which knowledge to gain and where to gain it from. And I think you ask your doctor which websites I can reliably use to know about my symptoms, and no doctor will refuse. There are authentic websites that are created by doctors as a knowledge center for patients. So it is better to access those websites and understand your symptoms rather than Googling it and getting scared.
Right. Thank you, doctor. We have a question from Katie Dadanchi, who says, is pancreatic and liver cancer genetically transmitted to family members and nephews and nieces of patient? And the second question that she's asking is eating meat and non-vegetarian food a cause for cancer?
Okay. So, to answer the first question, pancreatic and liver cancer, yes, there are genetic components to pancreatic cancer as well as liver cancer, but the percentage of these genetic cases is much lower as compared to what we call sporadic cases, as in those which occur in this generation. It may happen that this generation, the person who has developed pancreatic cancer or liver cancer in this generation may have a genetic mutation which he will transmit to his offsprings. But yes, if you have pancreatic or liver cancer, then it is better to get a genetic test, the relevant genetic test, so that you know whether or not you have passed on the same genes to your progeny. The second question, if I am
About
not
non-vegetarian
mistaken,
food.
non-vegetarian food. So, red meat consumption is typically linked with having colon cancers and liver cancers. They may not be directly causing the cancer, but they do cause some changes in the intestinal flora, intestinal normal bacteria that can increase the risk for cancer. So we always tell our patients that it is not the non-veg food that will cause cancer. It is the presence of processed meat. It is the presence of preservatives. It is the presence of more red meat in your diet that will increase your risk for cancer.
And doctor, what about masalas, etc.? If you have a lot of spicy food, like for instance, you mentioned you are from Nagpur, so if you have a
Yeah,
bit of Sauji, food, is that
I know.
harmful?
Uh, what I can say is that it's not beneficial. I mean, it's for taste. So it should only be consumed for taste. It cannot become your routine. Too much of anything is bad. So if you have some spicy food once in a while as a matter of taste, it's okay. That is not going to suddenly cause cancer. But if you keep having spicy food day in and day out, if you keep having a lot of masalas day in and day out, then yes, there have been instances of ulcers in stomach that have progressed to stomach cancer. So too much of anything, when it comes to diet, too much of anything is bad. A little bit of most things is okay enough.
You mentioned initially about the fact that in South India, there are more cases of stomach cancer.
True.
So is that a problem? For instance, in a place like Nagpur, etc., where you have very spicy stuff, are these issues that exist in these regions where one does have spicy food?
Like I said, that spicy food can irritate the lining of the stomach, and that is a risk factor for causing cancer. It may not always, like if 100 people have spicy food, does not mean that 100 people will have cancer, but it increases the risk. It is to give you an analogy, I think it is like crossing a red light, that uh, you may get away with it 9 times out of 10, but you may have an accident the 10th time. So if you can avoid it, avoid it. It's as simple as that.
Thank you, Doctor. Uh, Doctor, Mr. Sushil has asked, what are the symptoms and screening tests for colon cancer?
Okay. So again, colon cancer is one of the commonest cancers, and we see it especially among the elderly people. So it's a very relevant question. And the most common symptom is either a progressive kind of constipation, where the patient says that I've been, having increasing difficulty in passing stools, or the other thing is that the patient will have bright red blood in stools. So either of these symptoms are indicative that there is something growing in the large intestine, in the colon, that needs to be addressed. So these are the early symptoms. Of course, there are other symptoms as well, especially what we call significant weight loss. If you have lost more than 10% of your body weight in the last 5, 6 months, then it is a very grave sign that there is a tumor growing inside. So not only the local symptoms like constipation and bleeding, it is also these general symptoms like weight loss and loss of appetite that are indicative of cancer.
Right. Doctor, there's Mr. Sumer Chan Jain, who's 80. He's asking a question of symptoms of breast cancer in men.
Yeah. So symptoms of breast cancer in men are pretty much the same as breast cancer in women. That there will be a small lumpish feeling that is, that can be felt by the patient. There may be some amount of blood or, a bloody discharge from the nipples. But one thing that is very common in male breast cancer patients is that they will, more often than not, they will have a genetic history of breast cancer in their mothers, in their grandmothers, in their uh, aunts. Somewhere, a large number of these patients will have a family history, which it may be known or it may be unknown. But male breast cancer without a genetic component is very uncommon. So if you feel a lumpish feeling in your breast, especially the elderly men will feel that. If you feel a lumpish feeling in your breast, you go to a doctor, you go to a specialist, but please also get your family history. That was there any family member, or is there any family member currently in your generation, maybe your cousin, maybe your sister, who has a similar symptom? Because if that history is there, then the risk of that lumpish feeling being cancer increases tenfold.
Right, Doctor. I think it's an important point that you made. Doctor, one last question from CA Pushpa Shah is: can you please suggest authentic websites
Yeah.
you just now mentioned to get the right info?
So there is this website called Medscape, and Medscape offers a good amount of latest updated literature. I'm just typing the name of the website. Okay.
Right,
Yeah. So this offers doctors' perspectives, patient stories, as well as the latest research that has been done in the field of not only cancer, in all diseases. Okay. Apart from that, individual hospitals, individual cancer centers also have a patient FAQ section. Places which have been treating cancer for 50 odd years, like you have MSKCC in Boston, you have Mayo Clinic, you have Harvard. All of these major hospitals, now even Tata has one, Rajiv Gandhi Cancer Institute has one. All of these big cancer centers have a patient help center, patient FAQ center, where there are either pre-written questions along with answers, or the patient can send in their questions and get answers from doctors. So these are the knowledge centers that the patients should trust rather than simple Google or WebMD search.
right. Medscape, of course, is an international
Yes,
website.
yes,
Um, I must tell you that at seniorstoday.in itself also, we are very careful about what we publish as far
absolutely.
as medicine is concerned, and we prefer to take only doctors, articles from doctors, and of course we have the weekly Health Live session. Thank
Yeah.
you very much, Dr. Pande, for being here,
Thank you,
and
Mr. Mahesh.
to Fortis Hospital for having facilitated this. And on this World Cancer Day, let's hope the year ahead is better, is healthier for all of us. Thank you very much, Doctor.
Always. Thank you.
We will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. Thank you very much and have a healthy week ahead.
Thank you.
Subscribe now and press the bell icon. Never miss an update.